In St. Louis, Missouri and the surrounding areas, the Nurses for Newborns Foundation has a goal of preventing child abuse, neglect, and infant mortality through in-home nurse visitation. In 1993, the foundation established its Bridge to the Future program to serve medically fragile infants from birth to age 2. Healthcare, education, and parenting skills are provided cost-free to newborns and parents who are underinsured and have limited resources or access to care.
I realized that there needed to be a much more intensive program to deal with babies like Michael. And so the Bridge to the Future program was born. And that was for the purpose of being a bridge from the neonatal intensive care unit to the home, to make the home a warm, welcoming, and safe place for premature babies and medically fragile babies.
With the goal of lowering infant mortality and providing care to physically and socially vulnerable infants and families, the Bridge to the Future program helps over 815 families per year by making almost 4,000 in-home visits. The need for in-home nurse care is significant. Most of the babies in the Bridge to the Future program have serious risk factors for mortality or future health problems. 98% were originally discharged from the neonatal intensive care unit. Nurses perform the roles of nurse, teacher, coach, case manager, and child advocate.
Going overseas, I mean, to a combat zone is it's a hard thing to do. It's hard to keep your mind on your job, either pulling security, looking out for IEDs, trying to stay alive, or just do a good job when you're worried about your family at home and have extra worries about having a premature child at home. But with the program, I know I'll have the peace of mind knowing that someone is coming by once or twice a week to make sure my family's doing okay. I have faith that our nurse would make sure that my wife is doing okay and see how she's doing and see if we needed anything. And so far it's been a wonderful thing.
The success of the program relies on the many objectives it maintains, such as reducing child abuse, neglect, and injury, increasing immunizations, establishing a medical home for patients, limiting rehospitalization and unnecessary emergency room visits, and providing necessary food, clothing, and sleeping items for babies in the home.
A baby born in Cuba is 60% more likely to reach his first birthday alive than a baby born in St. Louis City. How can we say we're successful when babies are dying at a greater rate here than in one of the poorest nations on earth? There are many, many problems with our healthcare system, and we would be successful if we didn't need to exist at all because our healthcare system was working for the babies and the mothers, and I think that that's my ultimate goal, is to just not have to exist.
The program has achieved measurable success. In 2005 and 2006, no instances of child abuse or neglect and no rehospitalization of infants were reported for Bridge to the Future patients. Every baby in the program received food, blankets, and an infant sleeper. In addition, 90% were current on immunizations.
We do walk in the home and we do find newborns that within minutes of arrival the nurse is doing CPR. The nurse is calling an ambulance, the nurse is calling the pediatrician, sending the baby maybe to the doctor, to the hospital. We find moms that are extremely ill in the home, so we do save lives.
The ability for nurses to remain involved for up to 24 months provides continuity of services well beyond anything currently available. It provides stability to the many moms who are teens or unmarried and who may have a history of drug and alcohol abuse or domestic violence or abuse.
They teach you CPR if you haven't had CPR classes. They'll teach you how to bathe your baby, how to change your baby, how to feed your baby, how to burp your baby. If they're on monitors or anything, they'll show you how to use those and help you keep up to date on everything.
Bridge to the Future demonstrates incredible, life-changing outcomes. Babies survive due to this amazing service to St. Louis and its surrounding areas.